All right, so this has been some fantastic advice all around. I was wondering if there was one last piece of advice you would want to give somebody who is looking at oxygen therapy as a new part of their life, and what would you say to that person?
What I would say is please understand that wearing oxygen is not necessarily going to make you less short of breath. It really doesn't have much of anything to do with that. That's a rather different, that's a different subject in a sense for your lungs, because it's a different kind of thing. You're being short of breath is not necessarily related to why you're using oxygen in the first place. The reason that you're using oxygen in the first place is because on room air, you can't keep your oxygen saturation levels in your blood up above 88. And we believe that if they are below 88, that you are running the risk of organ damage, specifically brain damage and heart damage. And nobody wants either one of those things. So it's really important to understand that that is why you're getting oxygen. And if you wear your oxygen, the thing that you want to make sure is that you're getting enough oxygen from your tank or your concentrator or your portable oxygen concentrator, whatever, that you're getting enough to keep it above 88. And personally, I feel a lot better when mine's sitting at about 95, which is about normal, where that's probably where yours is, Mike, or maybe even higher than that. Normal people typically are run between 95 and 98%. So it's not at all, for me to have mine at 95 is just fine. So, and there are only very certain, very specific situations under which you would want your saturation level to be less. And those would be things that your doctor really needs to talk with you about. And the explanation needs to make a great deal of sense to you. Because there are some things about oxygen usage that can be problematic. But typically for most people, the reason you're using it is because your saturation levels are too low. And you need to get the supplemental oxygen to keep them at a level that will both keep you comfortable, but also make sure that you don't invite brain damage or heart damage. I think that's probably the most important thing I can think of. I guess the other thing that I would say to you is for new oxygen users, is learn as much as you can about the equipment that is available and how to use it. Unfortunately, this is one of those areas where a lot of docs don't have good knowledge. And because it's not something that they learn in med school. I don't think they do a home oxygen session with them. So they're very often not aware of the equipment that is available and what the limitations are for that equipment, or how it works and will it work for my patient. So those are things that you're really going to have to kind of suss out for yourself. Certainly, there are lots of boards and forums where you can get information. There are a number of websites where you can get really good information, but it's very important to do that before you jump into something. I would suggest to people that they start with a concentrator and tanks, because that's fairly easy to learn. And then you can figure out, okay, there's this thing called a POC. Now, is that something that I could use or not? Because there are a lot of places where you can learn about that. And you need to learn about it before you jump in with both feet.
Well, thank you very much, Gene Ramos, for sharing your experience and your knowledge with us today. And I'm sure this is going to be very valuable for many people who may be new to oxygen therapy or have questions that weren't answered in their initial setup, or even family or caregivers who might want to learn more about this. So again, thank you for spending some of your time with us today and educating the community.
No problem. I was glad to do it.